Hi everyone, good morning, good afternoon. Am I audible and visible, everybody? Okay, so good afternoon, everyone. Am I audible and visible? Give me a heads up if I'm audible and visible, guys. Alright, so as you all know, today we're going to deal with nutrition, guys. We have finished vaccines, EPID, concept of health, screening, PSM images, biostats. You are following the NEETPG Sure Shot, demography, contraceptives, environment. So today is nutrition. Now guys, 10th and 11th का जो lecture है ना, NHP with updates and diseases, this will be one lecture, guys. Alright, I will compile it into a single lecture, might extend a little, but it's going to be conducted on one single day. Alright, so I'll be taking it up on the 11th, guys. 10th we will not have any class, but on the 11th I will have diseases and NHPs together with all the updates. Is that okay, guys? So we'll be doing it as a single compiled lecture, the important diseases and programs, almost 30-35 MCQs. Okay. Alright, so let's look at the first question. Now nutrition is very vast, so I'm trying to focus on all the PYTs along with PYQs. The PDF has been shared on the Telegram group itself. So let's start with the first question. TB incentive is ₹1000. Okay, Nikshay Poshan Yojana is ₹1000. I'll discuss it day after tomorrow. The average daily dietary nutrient intake level sufficient to meet the nutrient requirement of nearly 97 to 98% healthy individuals in a particular life stage and gender group is known as, very good, this is recommended dietary allowance. RDA is almost, it satisfies the nutritional needs of nearly 97 to 98%, or you could say 97.5% population. If they ask you EAR, alright, estimated average requirement, estimated average requirement, estimated average requirement. So this estimated average requirement satisfies the nutritional need of nearly 50% of population. Alright, this satisfies the nutritional need of nearly 50% of population. RDA is always EAR plus some extra. Clear? Now we'll see what is prudent diet also in just a while. Okay? Alright, prudent diet, I'll tell you when we get a question on prudent diet, I'll come to that. Which of the following is a reference protein? Milk, meat, egg, pulses. Now this is a very basic question, but still we will be talking about this. Alright, so what is it? Which of the following is a reference protein? Everybody knows eggs. Egg is a reference protein because it contains all essential amino acids. It contains all essential amino acids, and also guys, its net protein utilization is 96, which is like almost equal to 100. Out of all the protein that is contained in eggs, all of it is being absorbed. Okay? And egg mein you have to follow the rule of 6. Rule of 6 means if you look at the average weight of a hen's egg, it is almost 60 grams. Okay, it gives us 60 kilocalories. It gives us 6 gram proteins. 6 gram proteins. It also gives us 6 gram fat. It is deficient in vitamin C though. Alright, milk, you all know milk, cow's milk is deficient in iron. Okay? Cow's milk is deficient in iron. That is very, very important. It's deficient. Therefore, babies who are weaned with cow's milk go on to develop iron deficiency anemia. Among the pulses, guys, soya bean is the richest source of protein. Soya bean is the richest source of protein. Soya bean is the richest source of protein. Alright, highest quantity of protein किसमें होता है? सोया बीन में highest quantity of protein. But best quality of protein is always in egg. Clear? PDF has been shared on the group. Please check it out once. I think I sent the PDF. Did I? Do this question. I'll just check once whether I sent the PDF or not. Oh, forgot. One second, I'll just send the PDF. Just a second, guys. Okay, now you can see the PDF in on the Telegram group, guys. I've shared it. Now you might think that why are we doing such basic questions, but trust me, these basic questions do turn up regarding the amount of fat, protein, all these things, RDA, trace element कौन होता है, major mineral क्या होता है. So we need to revise all of that. Highest percentage of essential fatty acid. Now which is the essential fatty acids, guys? Which is the essential fatty acid, everybody? So over here you must know the most essential fatty acid. Most essential fatty acids, okay? The most essential fatty acid is linoleic acid. The richest source of that is safflower oil. These are all PUFAs. Okay, you all know that if you talk about fats, they are of two types. ठीक है, saturated, unsaturated. Do it from biochem also, the bonding and everything. ठीक है, the bond structures. So fats होते हैं तुम्हारे saturated, they are the bad fats. Unsaturated. Not going into too much detail, but the richest source of each we should know. इसमें आता है MUFA, mono unsaturated fatty acids. इसमें आता है PUFA और इसमें है saturated, lauric, palmitic, stearic. Saturated में क्या है? Lauric, palmitic, ठीक है, palmitic, stearic. All right, lauric, palmitic, stearic. Now all this saturated का richest source क्या होता है? Richest source is coconut oil and butter and usually animal fats. Okay, meat, coconut oil, butter. Unsaturated में MUFA में है oleic acid. Oleic acid का good source is olive oil, guys. And if you talk about PUFA, everybody, PUFA is polyunsaturated. So over here you will have the linoleic acid, most essential linoleic, linolenic. All right, linoleic, linolenic. From linoleic we also derive arachidonic acid, and the richest source of all these are safflower oils, sunflower oils, corn oils. All these are good source of the unsaturated fatty acids. Now can anyone tell me linoleic is omega 3 or omega 6? How will you remember? Is linoleic omega 3 fatty acid or is it omega 6? Tell me in the comment section. I have given you a very important way to remember. Now see, linoleic is a small word but is a bigger number, omega 6. ठीक है, linoleic is a small word, but if you talk about linolenic, this is a bigger word, but it is denoted by a smaller number, omega 3. And remember one more thing, omega 3 are supposed to be more cardioprotective. That covers all of the questions that can come from this. ठीक है, saturated good source, unsaturated good source. The rest of course you have to study from your BChem as well. Okay, pasteurization, I thought I will make you revise once, since you know sometimes you don't read things like pasteurization. So just tell me the names of the tests which come. This is again an old PYQ, guys, but we should cover them as well. Which is the test to check the efficiency of pasteurization? You can do these three tests. Methylene blue reduction test doesn't check the efficiency. It checks whether the milk is fit for pasteurization or not. Okay, so look over here. Check the efficiency. Check efficiency of pasteurization. So when we have to check the efficiency of pasteurization, guys, we have the phosphatase test, we have the coliform test, we also have the standard plate count. Rest you can read. Okay? Alright? Instead of PCM, it is PCS. Or clear? But read over here, methylene blue reduction test. It is not used to check the efficiency of pasteurization. It is used to grade raw milk prior to pasteurization. So it is done something before pasteurization. Clear? Another question that comes is, what are the methods of pasteurization? Holder or Watt method, high temperature short time method, ultra high temperature method. Which method is most commonly practiced of pasteurization in the comment section, please? please. The method which is most commonly practiced on pasteurization, what is it? What is it? Is it Holder VAT method 63 to 66 degrees C, then cool for 31 minutes, or is it high temperature short time method? It's not Holder method, guys. It is high temperature short time method. Clear? It's high temperature short time method. That is the one we commonly do. Alright, we heat it to 72 and then we cool it for 15 seconds. Might or might not ask. Old question hai, kabhi if they want to trouble you, they can just pick it and repeat it for you. Alright, now our basic question, vitamin A, the Bible of all vitamins. What is the answer here? What is the dose of vitamin A prophylaxis needed in children aged 1 to 5 years coming from areas endemic to vitamin A deficiency? So now here I am talking about the preventive dose. Endemic from, that means I will talk about the preventive dose. Okay, now you all know preventive dose, everybody. At 9 months, how much do we give? We give 1 ml or 1 lakh international unit of vitamin A. Thereafter every 6 months, okay, thereafter every 6 months till 5 years, how much are we going to give? 2 ml or 2 lakh international unit of vitamin A. So this comes out to be total of 9 doses, or kitna amount? 17 lakh international unit. So it was asked about endemic, preventive dose. So this is which level of prevention? Primary level of prevention. That too, it is what? Specific protection. So if you look at this, how much vitamin A we have to give everybody? 2 lakh international unit every 6 months. These are all oral doses, and you know in the exam you can get a white color spoon like this, and they will ask you this delivers, this is used to give which vitamin. Okay, so in the exams आपको स्पॉटर में आ सकता है वाइट स्पून. ये जो वाइट स्पून जो विटामिन ए के बॉटल के साथ मिलता है, इट्स अ 100 ml बॉटल गाइज. यू डोंट नीड कोल्ड चेन टू स्टोर vitamin A. You can just keep it in room temperature away from direct sunlight, and once the bottle is opened we can use it up to 60 days. This one has an inner marking 1 ml and this one has an outer marking 2 ml. If you don't have this white spoon, you can also use the cap of the bottle. Okay? Now tell me answer to this. An 8-month-old baby shows signs of vitamin A deficiency. So here we will also talk about the nutrition part, guys. If agar baby malnourished hai to kya karna hai? Tomorrow is a class on malnutrition, so read and try to come for it in case. Good. Now if you remember, how have we learned? We give it on day 1. I'll show you other way also how the question was asked as we proceed. Up to 6 months, more than 1 year. So we all know we are giving which doses? The oral doses. So this one up to 6 months, 50,000 international unit. Okay, international unit. 6 months to 1 year is 1 lakh international unit. More than 1 year is 2 lakh. So I could also say consecutive dose, 2 consecutive doses on 2 days, day 1 and day 2. Now these are all oral doses. If ever we need to give IM dose, it will always be half of oral dose. So here it was 8-month-old baby. So what am I going to do, guys? We are going to give 8-month-old matlab 1 lakh international unit we're going to give orally. But in case the weight of the baby is below 8 kg, okay? Weight of baby below 8 kg, the dose is 1 lakh international unit irrespective of age. ठीक है, irrespective of age. ये पॉइंट एक याद रखना, ठीक है, irrespective of age. मान लो 15-month-old baby आता है is 8 kg. Ideally 15-month-old baby should be somewhere around 10 something, like 18 months old, somewhere more than that. So in that case you will always give it 1 lakh only, even if the baby is falling more than 1 year of age. ठीक है, you can also write 0, 1, 14, but now we usually prefer to write as day 1, day 2 and day 14. Am I clear? Everybody got this? Okay, another question. Xerophthalmia is a problem, vitamin A deficiency in the community if prevalence of Bitot spot is more than 2 times, 3 times this question has come. This is NEET PYQ, this is Fmge PYQ, this is INI PYQ, this is UPSC PYQ. सब में पूछा गया है, ठीक है? So that you should know. Bitot spot, very good, 0.5%. What about 0.1% if the prevalence is more than 1%? This is for night blindness. ठीक है, the epidemiological indicator that we consider Bitot spot. Okay, we can consider night blindness also, but more importantly, we take Bitot spot as the epidemiological indicator. And how do you find out the prevalence of this? We look for the vitamin prevalence of Bitot spot. We look for the prevalence in which age group? 6 months to 6 years. Now if I have to 6 months to 6-year-old children, we will look for the prevalence. Now guys, can you tell me, if I have to look for the prevalence, what is it that we are, with study design would I want to do? Can you just give me 1 second? Just give me 1 second. Put in the comment section which study design helps you calculate prevalence. What are you writing? Very good guys, cross-sectional study. Chalo, you remember this, that's great. And incidence, everybody, cohort study. Great. Now ये question is one of the patent loved questions by all the exams, so इसको पढ़ के चले जाना. Prevalence criteria for determining public health significance of vitamin A deficiency we are going to do among 6 months to 6 years, and you should definitely consider these values. ये तो आना ही आना है. Rest, corneal cirrhosis, ulceration, keratomalacia 0.01%, scar 0.05% से ज़्यादा, and plasma vitamin A level we should also, serum retinol basically we should also take care. What is the richest source of vitamin A guys? Vitamin A and vitamin D. They have asked this. What is the richest source with that? It is halibut fish. Both vitamin A and vitamin D, richest sources halibut fish. Moving to the next question. Alright, so image based question can turn up. This one over here, superficial raised area on the temporal side of the bulbar conjunctiva में जो देखोगे, this is X1B, Bitot spot. Alright, and this one more specific finding, this is your conjunctival xerosis. If you remember WHO का classification याद है सबको? I'm not going to write everything, we'll just talk about it one. X1A is conjunctival xerosis, X1B is Bitot spot, X2 is going to the cornea, corneal xerosis, X3A is corneal ulcer, less than 1/3 of the cornea, X3B is keratomalacia, more than 1/3 of the cornea. All these are reversible guys, ठीक है. X3A और X3B ये नॉन रिवर्सिबल है, ये रिवर्स नहीं होता, ठीक है. एंड दीज आर योर प्राइमरी फाइंडिंग्स. बट इफ समबडी आस्क्स यू व्हाट अबाउट द सेकेंडरी फाइंडिंग्स, सो रिमेंबर द सेकेंडरी फाइंडिंग्स: XN नाइट ब्लाइंडनेस, XF फंडल चेंजेस, XS स्कार. सबसे कॉमन प्रेजेंटेशन, most common symptom, most common presentation that a person will come with is your night blindness. But the first sign that the doctor observes is the first sign conjunctival xerosis. He sees a non-lustreless, मतलब lustreless आँख है, non-wettable appearance. Okay, let's go to the next one. A couple of vitamins that often get repeated. So what is the answer here? Hello. Yeah, very good. Polished rice eaters, thiamine. Polished rice eaters में क्या देखने को मिलता है? Thiamine deficiency and B1 deficiency. Also you will see this among chronic alcoholics. Chronic alcoholics. chronic alcoholics also present with B1 deficiency that manifests as Wernicke-Korsakoff psychosis. Wernicke-Korsakoff psychosis. इसमें क्या होता है? ऑफ्थाल्मोप्लेजिया, मेंटल रिटार्डेशन, ठीक है, डिप्रेशन, ऑफ्थाल्मोप्लेजिया हो जाता है, अटैक्सिया or mental retardation. So they can give you all these three conditions. Also people who chronically fast, हर मतलब most of the time they are fasting, chronically fast, they also suffer from thiamine deficiency. And one more question that could come, guys, if I ask you, rich is rice a good source of thiamine? Please remember, rice is a good source of thiamine. Rice is a good source of thiamine. जो rice होता है ना, good source of thiamine होता है. But जब हम लोग राइस को पॉलिश करते हैं, particularly in areas like Andhra Pradesh, when the rice is polished and eaten, okay, polished by a process of milling, all the thiamine that is present in the endosperm layer, guys, gets lost. Okay, so if the question comes, is rice a good source of thiamine? Yes, it's not the richest source. Richest source of thiamine is gingerly seeds. Alright, richest source of thiamine. So richest source of thiamine, guys, gingerly seeds होता है. कब भी कोई पूछ लिया तो बता देना, gingerly seeds. Yeah. Moving to the next question, guys. In a particular village, people are complaining of diarrhea, dementia, rash on exposure to sunlight. On questioning, it was reported that the diet majorly contains maize. So among maize eaters, what do you see, guys? Among maize eaters, you see niacin deficiency. Now the thing is, next time they can give you maize eaters तो दिया हुआ है. We can also have jawar eaters, we can also have sorghum eaters. इन सब में niacin deficiency होता है. But actually is it due to the deficiency of tryptophan? No, maize में tryptophan is limiting. But what happens, guys? Tryptophan gets converted to niacin. 60 milligram tryptophan gives us 1 milligram of niacin, everybody. But over here among maize eaters क्या होता है? Excess of leucine होता है. This excess of leucine will prevent the conversion of tryptophan into niacin. So it is because of the excess of leucine leading to the characteristic pellagra, diarrhea, dermatitis, dementia, delirium, depression, death. It can range from 4 to 60s. Clear? So this image has come in your exams. Hyperpigmented patches है, castle's necklace appearance है, ठीक है, castle's necklace. Anything can come in your exams, and it presents with almost 60s. Moving to the next one. Now see, we have made a chart for you. You can just go through this. Thiamine क्या करा रहा है? We have already done. Beriberi में wet beriberi is dangerous. Riboflavin, angular, I discussed in image-based session. Kilosis, angular stomatitis, geographical tongue. Angular stomatitis specific finding होता है. Niacin अभी हमने पढ़ लिया. Pantothenic acid, burning feet syndrome. Pyridoxine, very very important. Seizures in infants, okay, seizures in infants pyridoxine भी करवाते हैं. And any person who's on isoniazid, you will give them, you will ask them to eat B6. B9, folic acid, megaloblastic anemia, neural tube defects, infertility, also it can lead to B12, pernicious anemia, B12 deficiency among vegetarians. Rest you can read. Is it clear? B12, beefy tongue, that we discussed the other day also. Okay, moving to the next question. Easy. A 28, this is also a PYQ. A 28-year-old male presented with complaints of bleeding gums. Blood investigation showed iron deficiency. So simple question tha, bleeding gum, vitamin C. But guys, the next time they gave a question ki क्यों delayed wound healing है vitamin C deficiency में? Why is it there easy bruising? Why? Because vitamin C deficiency leads to what defect, guys? It leads to collagen defect, and collagen, everybody, is the building framework of our tissues. So collagen defect results in vitamin C deficiency, scurvy. And if you remember the image-based session, I told you the name of a scientist who had shown all this among sailors, James Lind. उसका image याद है? he worked for scurvy. Scurvy से curvy याद रखो. Hair was all curved with roll-ons. It looks like he has curled his hair. If you try to recollect his image, okay, that's how you will remember him. Clear? And the richest source from the image based session, you remember the green color thing that I showed you? Richest source was amla, or as you remember, Indian gooseberries. Richest source was amla or Indian gooseberries. मतलब ये एक slide में सारे PYQs हैं which have come before. Now a couple of questions from food adulteration. 40-year-old female, no comorbidities, presents with acute onset, a very big hint, acute onset of swelling in both legs. She also reports experiencing loose stools and her family members have similar symptoms. Detailed history, mustard oil. Staple diet hota hai which is consumed by maximum people around of that particular community. So over here basically the female has suffered from epidemic dropsy. In that what happens guys? Contamination of mustard oil with argemone oil. Mustard oil has argemone oil is the adulterant and this sanguinarine is present in which oil guys? Argemone oil. So the if anybody देखो question को ध्यान से रखना, food adulteration में you have a food item. Food item is mustard oil. You have a adulterant. Adulterant is argemone oil जिसको we are mixing, and we have a toxin. Toxin over here is sanguinarine. Is it clear? And one more characteristic features. It is sudden in onset, acute, non-inflammatory edema. Acute non-inflammatory edema. It's not inflammatory. It is non-inflammatory edema. That's your buzzword. And how do you check for argemone oil contamination? Anyone in the class check for argemone oil contamination? Why is it going? Check for argemone oil contamination. कैसे check करते हो argemone oil contamination guys? This is wrong. Just a second, I'll just take this out and put it again, okay? This wire, yeah. So you have two tests guys, nitric acid test. Remember, nitric acid test is a very raw test, okay, that we do in the fields, but more sensitive test, alright, more sensitive test that can even detect 0.0001% argemone oil contamination. So more sensitive test over here is chromatography test, paper chromatography. These are the question, it came last time also in NEETPG, so it can get repeated again, it can come in Fmge exams also. Alright, all of the following are used to treat Kesari dal toxicity except ban the crop, toxic removal, vitamin C, DEC. DEC हमें पता है, this is used in treatment and prophylaxis of filariasis. Treatment and prophylaxis of filariasis. Okay, treatment and prophylaxis of filariasis. Now over here if you see, पूरा chapter है nutrition, check it out once. Okay, now what is the answer over here? We banned the crop, toxin removal, vitamin C. Kesari dal toxicity, neurolethyrism. Neurolethyrism में chronic, it is chronic in onset and gradual onset of spastic paralysis, not the flaccid. And please remember, osteolethyrism is not reported in humans. Okay. Alright, a worker at a groundnut factory developed food poisoning after consuming stale groundnuts. Yeah, MP Bihar Orissa, that's correct. After consuming stale groundnuts stored at the facility, what is the most likely cause? You all know, groundnut का contamination हो जाता है, infestation by a storage fungus. Storage fungus, what is the name of that storage fungus? Aspergillus flavus. Aspergillus flavus, and it releases aflatoxins leading to aflatoxicosis, presenting with HCC also, So this chart is there, you can go through it later. See aflatoxins, next time they can give you cereals and maize. हमें क्या करना है, नेक्स्ट टाइम दे कैन गिव यू हाउ कैन यू प्रिवेंट इट, कीप द मॉइस्चर कंटेंट बिलो 10%. ओके, दिस दे हैव नेवर आस्क्ड. हाउ विल यू प्रिवेंट इट, कीप द मॉइस्चर कंटेंट बिलो 10%. मिलेट्स को एंडेमिक असाइटेड, मिलेट्स इज कंटामिनेटेड विद क्रोटोलेरिया झुनझुनिया सीड्स. देन दे कैन गिव यू सॉर्गम, राई, बाजरा. देखो ये वाला चीज याद रखना, ग्राउंडनट, सीरियल्स, मेज, aflatoxins. Okay, autism is sorghum, rye, bajra. And guys, how will you ensure? See, what is adulteration? We are adding something to the food that is going to affect its quality. So how do you prevent this adulteration? So you have to remember minimum quality of food products. Okay, minimum quality of food product is according to which act? Minimum quality of food product is according to Prevention of Food Adulteration Act. Prevention of Food Adulteration Act. Okay, PFA Act. Prevention of Food Adulteration Act. याद है सबको? मिनिमम क्वालिटी के लिए PFA Act है. If I want quality above minimum, then which logo should I get? Quality above minimum. I'll show you its image also. Quality above minimum, that means I desire excellence, not just in food items, in jewelries, in electrical appliances. We need the BIS mark, Bureau of Indian Standards. ठीक है? Yes, papaya seed to black pepper, that was also one of the ones. There was a question, I'll try to get that question also. Clear? Last time question क्या आया था? Which is not food adulteration. Example of food adulteration. The answer was fluorosis. Fluorosis is not an example of food adulteration. This we already know. This is neurolathyrism. Here you can see the 2-stick stage. Pay very good attention to this one. MP, UP, Bihar, Orissa. This is khesari dal. People are still growing this khesari dal and mixing with which dal, guys? Arhar dal. अरहर दाल सांबर दाल होता है. ऑल्सो दे आर मिक्सिंग इट विथ चना दाल. ठीक है, चना दाल और अरहर दाल से दे आर मिक्सिंग दिस खेसरी दाल. ठीक है, it's very cheap to grow, very easy to grow. This I have discussed in your in your image based class. This is epidemic dropsy, guys. This is your argemone mexicana flower, non-inflammatory edema. ये हो गया argemone mexicana flower. Okay, moving to the next one. Identify the logo. Already done. Can you tell me the answer? Good. Bureau of Indian Standards. Very good. Bureau of Indian Standards. AgMark is for agricultural product. Okay, AgMark is for agricultural product. We also have one Food Corporation India, that is not that important, but FSSAI is important, guys. FSSAI, Codex Alimentarius, this has been discussed in image based session. FSSAI is Food Safety and Standard Authority India. This has given us the national food standards. It has given us the national food standards. And you also have to remember that FSSAI का जो हेडक्वार्टर है वो न्यू दिल्ली में है. ठीक है, एंड वी अडोप्टेड दिस FSSAI फ्रॉम कोडेक्स एलिमेंटेरियस विच गिव अस द इंटरनेशनल फूड स्टैंडर्ड्स. BIS already discussed. BIS is a part of ISI, guys, Indian Standards Institute. Okay, all right. Yeah, prudent diet. What is prudent diet? Prudent diet क्या होता है? जिनेवा में WHO है. यस, FAO का हेडक्वार्टर रोम में. what do you mean by prudent diet, everybody? Prudent diet is diet for dietary goal achievement, diet which contains variety of food that prevent deficiencies, diet on which a person sustain, diet which means RDM. कोई एक नहीं, it's not option B, guys. I had taken up this question in Sure Shot NEETPG also, because I have this hint a couple of you, most of you in fact would not get it correct. देखो prudent diet क्या होता है? Like it's a diet to prevent CVD. It's not to prevent deficiencies. It has a particular dietary goal achievement. समझ रहे हो? It has a particular dietary goal achievement. What is that dietary goal achievement? Let me take you to that slide which was given on the first page. What is prudent diet? Can you see this is prudent diet? It has a specific dietary goal achievement. Now can you see? See, it's a very basic question and most of you made a mistake over here. What is the goal achievement here? We want saturated fats in our diet to prevent, this is particularly to prevent CVD, and we want the saturated fats to be 15 to 30%. The total fats, not saturated, total fats. Saturated fats up to 10%, 7 to 10%. ठीक है? Excess refined carbs should be avoided. Some amount of rich fibers. फाइबर्स जो हमारे डाइट में होना चाहिए 40 ग्राम फाइबर, ठीक है, डेली 40 ग्राम फाइबर्स एंड 40 ग्राम फाइबर्स वी शुड टेक. सम अमाउंट ऑफ फैट अल्कोहल रेस्ट्रिक्टेड, सॉल्ट इनटेक लेस देन 5 ग्राम, protein 10 to 15%. So these are goals. Goals means we have to achieve certain things. Now is it clear? Alright, everybody got this question. Prudent diet is something we've discussed. Prudent diet in this thing also in the chapter of NCDs you will find in the on prep ladder. Okay, now since it's a revision class, I've spoken about here. Prudent diet is meant to achieve specific dietary goal achievement. Dash diet किसके लिए होता है? अब ये भी डैश डाइट, डाइटरी अप्रोच टू स्टॉप हाइपरटेंशन, डाइटरी अप्रोच टू स्टॉप व्हाट? डाइटरी अप्रोच टू स्टॉप हाइपरटेंशन. ऑलराइट, डाइटरी अप्रोच टू स्टॉप HTM. दिस इज योर डैश डाइट. The frontal anterior incisors of a child who had white patches on them turned brown following over supplementation of which of the following? Over which of the following? Way in out. This is mottling of the upper incisors of the teeth. So this is fluorine. Now I don't know, some of you have a doubt guys. मुझे एक बात बताओ, I think टेलीग्राम पे कल क्वेश्चन था कि डेंटल फ्लोर या जो कट ऑफ फ्लोरीन का है पानी में, ठीक है, सी सर्वेलेंस ऑफ ड्रिंकिंग वाटर के लिए वी अलाउ 0.5 to 0.8 मिलीग्राम पर लीटर ऑफ फ्लोरीन in drinking water. All right, but when does dental fluorosis occurs guys? When does dental fluorosis occur? It is not at 0.8. Dental, this they are talking about mottling of anterior incisors of the teeth. This is dental fluorosis. Dental fluorosis is when the fluorine content is more than 1.5. 10 कहाँ से आ रहा है? 10 is not dental fluorosis. 10 is crippling fluorosis. Don't get confused guys. Skeletal fluorosis if you talk about is when fluorine content is 3 to 6 milligram per liter. And if you talk about crippling fluorosis, everybody, crippling fluorosis means knock knee. Knock knee matlab not varum, the knees have stuck, jud gaye, knocked together. So this is what? Genu val gum, gum se they have stuck, gum say they have stuck. So it is more than 10 milligram per liter. And there should not be any confusion in this. One more question. Fluorine is a major mineral or a trace element? Anybody? Put in the comment section. Fluorine major mineral होता है या trace element है? Good. I have told you trace elements are something that are needed less by the body, but by MCQs they are very important. Fluorine, iodine, iron, ठीक है, zinc, these are all trace elements. Major minerals are like calcium, potassium, they are all major minerals. Clear? So this is your fluorosis. Now see, this one is an image of dental fluorosis. And how will you remove excess of fluorine from water? So we use a technique which is known as Nalgonda technique to remove excess of fluorine from water. Clear? And we will add lime, alum as well as bleaching powder. That's what is added. Lime, alum is aluminium only, and bleaching powder. These are the things that we will add. But fluorine, remember, the deficiency is also a problem. So this one right over here is dental caries. Dental caries is the most common school health reported infection. All right, it is the most common school health reported infection. सबसे common school health reported infection क्या है? Most common school health reported infection, everybody, is dental caries. Now what happens in dental caries? Fluorine का content is below 0.5. Okay, so that is the most reported school health infection, and fluorine content is below 0.5. So fluorine, you have to remember, is also known as a double-edged sword. Double-edged sword means the excess is also a problem and the deficiency is also a problem. Like you can see over here, this is Jenu, welcome, and these states could be mentioned. ये तुम्हारा crippling fluorosis हो गया, ठीक है? And this problem is endemic in all these regions. They can write AP, Kerala, कुछ ऐसे states में ध्यान देना, because they could be like a hint in your questions. Alright, yeah, some of the calorie requirements, additional calorie requirement for a sedentary pregnant woman in her second trimester is. On an average in all the trimesters, plus 350 kilocalories per day. ठीक है, on an average. This is according to National Institute of Nutrition. The headquarter is Hyderabad. On an average. But अगर कोई आपसे पूछ ले trimester wise, please remember first trimester ideally no extra calorie, or I could say it is very very less. ठीक है, 75 to 80 kilocalorie plus X per day. Second trimester, it's in the range of 200s guys. 200s के range में है, 220 to some 80 kilocalories per day. Alright, extra. But third trimester, maximum weight gain of the baby at 7 months is 1 kg. Maximum weight gain third trimester में होता है. So it's around in the range of 400s guys. 390 से लेके some 450 kilocalories per day. So be very careful if the question is trimester wise. Okay, you should remember the trimester. Second trimester 200s, third trimester 400s maximum. If you do an average of it, it comes out to be plus 350. First 6 months of lactation, how much additional calorie? First 6 months lactation. So if I say first 6 months, it is plus 600 kilocalories or calories per day. Next 6 months, if I say next 6 months कितना है? Plus 520 kilocalories per day. और ये plus किस में कर रहे हो? Can anyone tell me where are you adding this plus to? Like, am I adding to randomly some picked up number? 1000 plus 120? 1500 plus 120? ये जो plus है आप किस पे करते हो? RDF what guys? So what is that value to which you are going to add? Please remember sedentary female, ठीक है? Sedentary female को कितना calories चाहिए हर दिन? 1660 kilocalories per day. If you can remember 1660, good. Or like I've taught you, you can remember 1700. So this plus 350 pregnant female, if I talk about pregnant female, it has to be added to plus 350. So that is 2010 per day. Is it clear? You should remember this. कि plus हम कर किस में रहे? So if you remember 1660, well and good. Okay. Now see, let's revise. So we've done this before also. No. First question आएगा. Where's the question? 1 second. I have to take you that question. Yeah, पहले ये question करो. What is true about the reference woman for RDS? Then we'll revise the RDS. We'll go back to that question which just came. What is true about reference woman for RDA? Yeah, height is 1.62 meters. So just go through this criteria of reference man and woman guys. Age is 19 to 39 for both. Weight is 65 kg, woman is 55 kg. BMI अलग से देखना है तो मैन का ऑफ कोर्स 20.75, वुमन 20.95. हाइट ऑफ कोर्स मैन का ज़्यादा है 1.77 meters, 1.62 meters. 8 hours of sleep, 8 hours of moderate work, 4 to 6 hours of sitting moving. ठीक है, so that you should remember. All right, clear guys? So this is your reference man as well as reference woman. So over here weight 60 kg नहीं है, reference woman का 55 kg है. Work not 10 hours per day. Age is most important, 19 to 39. Clear? So for RDs are set for this age group. I hope you remember sedentary, moderate, heavy worker. सबको याद है? If I talk about reference man and woman, all right? Here it is sedentary, moderate, heavy worker. Sedentary, moderate, heavy worker man. So what was the energy requirement for sedentary, moderate, heavy worker man? This you can remember 2110, and you can also, or in very easy way I'll make you remember 2110 याद कर सकते हो. Moderate is 2700 and the same amount, just a second guys, I think the pen is not charged. I'll have to charge it once. Give me one moment please, I'll just charge the pen. I'll discuss with you, ठीक है? Meanwhile the pen is charging. बोलो sedentary worker कितना है? 2110. Moderate worker कितना था? 2700. And the same amount is by a moderate and heavy worker female, 2127. And sedentary worker female, if we talk about, is 1660, and double of that 3400 is for man. So reference woman का क्या है? Or let's start with reference man, sedentary, moderate, heavy, 2127. For a reference woman, moderate, heavy, 2127. Sedentary woman 1660 or 1700. Double of that 3400 for a man. Clear? Everybody, सबको याद है ना? चलो, let me see if this pen got charged or not. Forgot to charge it today. Let's hope it is charged. Okay, थोड़ा तो हो गया. Let's continue. All right, so we were left with these questions. Anemia Mukh Bharat, one of the favorite MCQs, all about Anemia Mukh Bharat कर लेंगे. Pregnancy lactating, अभी मैंने बताया ना चमन, pregnancy plus 350. So I told you what you have to add it to. First 6 months of lactation plus 600, second 6 months of lactation plus 520. Okay, under Anemia Mukh Bharat, what is the recommended iron folic acid dosage for adult pregnant woman? All of you know 60 milligram elemental iron and 500 microgram folic acid per day. But under Anemia Mukh Bharat, FMG में question आया था, which can come for NEETPG also. Started second trimester onwards, continued 6 months post delivery. And what was the purpose of this iron folic acid? What was the purpose of this iron folic acid? So you all know आयरन में ये तुम्हारा अनीमिया मुख भारत का लोगो है. These are the, it relies on 6x6x6 strategy discussed in image based sessions also. 6 beneficiaries, 6 interventions, 6 institutional mechanisms. These 6 interventions पढ़ के जाओगे, you will find it in the other lecture also in image based session. We are giving prophylactic iron folic acid. We are carrying out deworming का 2 days है, 10th of Feb and 10th of August. We are also promoting behavioral change communication, health education, delayed cord clamping, Testing anemia using digital point care methods. आयरन फॉलिक एसिड रिच फूड देना है, एज वेल एज नॉन न्यूट्रिशनल कॉजेज ऑफ अनीमिया को एड्रेस करना है. एवरीथिंग अबाउट दिस हैज़ टू बी डन गाइज. दिस इज अ वेरी वेरी इंपॉर्टेंट. दीज डोजेज ऑल्दो आई हैव डिस्कस्ड इट मेनी टाइम्स, आई कीप रिपीटिंग क्योंकि आता है. 5 to 9 years 45 milligram, 6 to 59 months 20 and 100 बाई वीकली. वीक में 2 बार सिरप पिलाओगे. 5 to 9 years को पिंक टैब्स दोगे. एडोलिसेंट्स को आयरन की नीली गोली ब्लू टैब दोगे, ठीक है, 60 and 500. एंड रिप्रोडक्टिव एज फीमेल्स अगेन वील गिव वीकली, बट दोज आर रेड टैब्स. एंड प्रेग्नेंट वुमन आई हैव ऑलरेडी टोल्ड यू डेली रोज आर रेड टैब. Remember, the purpose of iron is to prevent iron deficiency anemia. The purpose of folic acid is to prevent megaloblastic anemia. ठीक है, megaloblastic anemia. The purpose of folic acid is to prevent megaloblastic anemia के 2 important causes guys. एक of course folic acid deficiency, vitamin B12 deficiency, alcohol. Alcohol is one of the most important cause for megaloblastic anemias. All right, features of anemia that you learn from your pathology. Don't say NDD. The purpose is to prevent megaloblastic anemia. Anemia मुख भारत बहुत फेवरेट क्वेश्चन है गाइज एग्जाम में, इसीलिए इस बार ना आई हैव मेड अ चार्ट वेयर हाउ विल यू मैनेज माइल्ड टू मॉडरेट अनीमिया अंडर अनीमिया मुख भारत. रिमेंबर वन थिंग, टू कॉल अ वुमन अनीमिक इन प्रेगनेंसी, हीमोग्लोबिन कितना होना चाहिए? बिलो 11 ग्राम पर डीएल. ठीक है, कट ऑफ प्रेगनेंसी में अगर 11 ग्राम खून है इट इज़ गुड, चलेगा. नॉट गुड बट चलेगा. बिलो 11 शी इज़ अनीमिक. डोंट से 11 के नीचे शी इज़ अनीमिक. सो यू हैव टू चेक फॉर जेस्टेशनल एजेस. इफ द जेस्टेशनल एज इज लेस दैन 34 वी डोंट गो फॉर इंजेक्टेबल्स. If she can eat IFA, instead of giving her the prophylactic 1 dose, we give her 2 tablets of IFA. If she is not tolerant to IFA, then only we stick to IV sucrose or IV peroxycarboxymaldose. We will not give IM. But in case gestational age is more than 34 weeks, guys, all right, in that case you give IVs. Injectables, ठीक है, even if she is a case of mild to moderate anemia. But in case she is a case of severe anemia, tablets देना ही नहीं है. You have to look for first or second trimester. If the hemoglobin is 5 to 6, IV iron sucrose, IV ferric carboxymaltose लेस देन 5 है तब तो हॉस्पिटलाइज करके ब्लड ही चढ़ाना पड़ेगा. थर्ड ट्राइमेस्टर में इवन इफ इट्स बिटवीन 5 to 6.9 यू हैव टू हॉस्पिटलाइज. गो थ्रू दिस टेबल गाइज. This is very very important. All right, so what did you mark for that? See, below 11 is the cutoff. मतलब हम लोग हीमोग्लोबिन प्रेगनेंसी में 11 है, that's okay. ठीक है, prophylactically like 11 gram is acceptable in pregnancy. Below that the woman is anemic. Am I clear? अब question कैसे भी आ जाए. चलो let's quickly do a couple of more questions then wrap it up. Which nutrient does a lactating female require more than a pregnant female? Anybody? तो क्या मार्क किया? What did you mark guys? 11 ग्राम is cut off. 11 in pregnancy is acceptable. No, it is below 11 which is not. So below 11 you have 10.5. You can go for that one. Yeah, pregnant female, what all she requires? So just have a look over here. Calcium 1200 हो जाता है, ठीक है, in lactation. Calcium is more. Calcium, vitamin A, iodine बढ़ जाता है, carbs बढ़ जाता है. More in lactation. What about pregnancy? Iron, folic acid. More in pregnancy. All right. So if you have to talk about pregnancy, iron, folic acid, zinc, protein. ये तुम्हारे more in pregnancy. ठीक है? Yes, of course. Very good. We just discussed that cutoff. एक सेकेंड में थोड़ा सा कुछ प्रॉब्लम हो रहा है. मैं ओपन एडवांस करना आप ओके. Alright, this chart all of you will go through. अगर तुम्हारे पास अभी टाइम है, squeeze in some time. 5. This one I want all of you to know. Iodine 280 in lactation, guys. ठीक है. बाकी एक बार देख लेना, विटामिन डी सेम रहता है, आयरन, फॉलिक एसिड ऑफ कोर्स, बट फॉलिक एसिड टू प्रिवेंट एनटीडी अकॉर्डिंग टू डब्ल्यूएचओ एनटीडी प्रिवेंट करने के लिए फॉलिक एसिड कितना बोलता है लेने, नॉट 570, 400 माइक्रोग्राम फॉलिक एसिड. एंड इफ अ वुमन ऑलरेडी हैज अ बेबी हु सफर्स फ्रॉम एनटीडी, देन अ वुमन हैज टू टेक 4 milligram. Woman with an NTD baby, all right, and she should, and they have to take it when she plans to conceive, या 4000 microgram. कुछ भी लिख के एग्जाम में आ सकता है, so please don't get confused. Go through this chart whenever you have time. This I have just summed up for you. Major minerals कौन कौन से है, trace elements I want you to remember, iron, iodine, फ्लोरीन याद रखो, जिंक ये आता है, चारों पे क्वेश्चंस भी आते हैं. कैल्शियम के साथ फॉस्फोरस ऑलवेज कम्स अलोंग, सोडियम, पोटाशियम, मैग्नीशियम, दीज आर कपल ऑफ थिंग्स यू शुड रिमेंबर. टोटल एनर्जी इन हाई फैट इनटेक फूड, एनी आइडिया? हाई फैट इनटेक कितना एनर्जी देता है? Good, 1000 kilocalories. Just go through it, okay? Proteins in our diet, guys, make up 10 to 15% of our diet, balanced diet. Then you have this one, fats. Fats should make up 15 to 30% of our diet. Carbs should make up 50 to 70% of our diet. Per gram protein 4 kilocalorie energy, per gram fat 9 kilocalorie energy, 4 kilocalorie per gram carbs. Dietary fibers कितना देता है, 2 kilocalories per gram, okay, 2 kilocalories per gram. Alcohol 7. Not a part of Anina Mukh Bharat, already discussed. जितनी जल्दी हो सके आंसर लिखो. 6 into 6 into 6 strategy. So 6 beneficiaries, 6 interventions. मैंने अभी बोला था 6 institutional mechanisms, 6 functionaries नहीं होता है. Why is there so much of confusion, guys? 6 beneficiaries, 6 interventions, 6 institutional mechanisms. Functionaries कुछ नहीं है, 6 ministries नहीं है. Those are some mechanisms that we don't have to really go into too much of detail. Alright, RD of iodine for lactating women, already done. Quickly give me the answer. Iodine का RDA कितना है for lactating women? RDA for iodine, RDA of iodine lactating, yeah, we'll have to wait 5 more minutes. 280, good. Micrograms per day. Okay, pregnancy 250. Lethal BMI in men, just revising a couple of one-liners here which have come before. Lethal BMI in men, that means the BMI the men can tolerate. Lethal, the lowermost level. Lethal BMI in men 13, less than 13. This is the lethal BMI in women, less than 11. Lethal BMI in women. Vitamin A for a 2-year-old boy with keratomalacia, already discussed. Can you give me the answer? Can you give me the answer? 2 lakh international unit immediately, followed by so much after 24 hours. 2 lakh immediately followed by after this thing. Now see, 2 year, that means we have to give 2 lakh, more than 1 year 2 lakh. 2 lakh international unit followed by same dose 24 hours later and again after 2 weeks. So did you see, exam में ऐसा भी लिख के आ सकता है, 2 consecutive doses on 2 days. 2 consecutive doses on 2 days. That's how also they can write in the exam. तो confuse मत हो जाना. Day 1 and day 2, 2 consecutive doses on 2 days. Okay, a man from Chhattisgarh, progressive leg leg spasms and muscles weakness, pure motor paralysis. Chhattisgarh, leg spasms, spastic paralysis. So what is this, guys? The man is suffered from neuroletharism. So whatever history am I going to take? The dietary history. ठीक है? Okay, let's go to the next one, guys. A patient from rural village was given ORS plus zinc. What dose of ORS? What does ORS plus zinc do? मैनेजमेंट ऑफ डायरिया वी विल रिवाइज इन डिजीज क्लास, ठीक है. बट अभी इसका आंसर तो एक मतलब क्वेश्चन बताना था कि जिंक क्या करता है. सो ऑल ऑफ यू नो इट डज, इट्स नॉट. रिमेंबर वी विल टॉक अबाउट ORS. ORS में देर आर components which enhance sodium absorption and all of those things that we'll discuss the other day. But over here जिंक का काम देख लो, ड्यूरेशन ऑफ डायरिया को कम करता है. 10 to 14 days we should give the child 20 milligram zinc tablet suspension के form में. Less than 6 months है then we stick to 10 milligram half a tablet, otherwise we give 20 milligram of zinc tablet. I just wanted you to see this MCQ once. Okay. Best index for calculation of nutrient value of a protein. Up, can you see the years? They are all old questions but they can come anytime, guys. Best index for calculation of nutrient value of protein. If I have to check for the nutrient value of protein, what am I going to look? Serum albumin concentration, arm muscle circumference, creatinine height index, serum transferrin level. Please remember albumin देखोगे, ठीक है. एंड आयरन डेफिशिएंसी अनीमिया के लिए एपिडेमियोलॉजिकल मार्कर क्या है? एनीबडी? आयरन डेफिशिएंसी अनीमिया के लिए इफ आई हैव टू go to the fields, what am I going to check for? Hemoglobin, transferrin saturation, serum ferritin levels. Both are question. Good, Suvi. It is serum ferritin levels. It is serum. See, these are choti cheezein, you know. We might think they don't come, they do come, guys. Serum ferritin is for this one, and protein ke liye we check for serum albumin concentration. Richest source of iron बता दो. Richest source of iron, anybody? Richest source of iron, can anyone tell me the richest source of iron? It is dried pumpkin seeds. Dried pumpkin seeds, ठीक है. All right, dried pumpkin seeds. The next one is pistachio seeds, but it is dried pumpkin seeds. Okay, next one. Nowadays what is the most common pasteurization method? अब भी मैंने बताया था, जितनी जल्दी आंसर हो सके लिखो. Most common pasteurization method already discussed. Good. High temperature short time method, and we have seen 15 seconds में उसको ठंडा भी करना है. So I'm not taking too much of time over here. Which vitamin helps in iron absorption? क्या है इसका आंसर? विटामिन सी. Why does it help in iron absorption? What if the next time they give you something regarding why? So look at this. Vitamin C enhances iron absorption by reducing ferric iron to the more absorbable ferrous form. पढ़ लो, हो सकता है they can ask you, they can write the ulta ones that it is helping in converting ferrous to ferric, something like this they can make up, ठीक है. So it is reduces ferric iron to the more absorbable ferrous form. Ferrous form is more absorbable. 1x encephalopathy is due to deficiency of 1x. 1x encephalopathy, Korsakoff already done it. Thiamine, ठीक है, already done is thiamine. How will you screen vitamin A deficiency in a school? School में कैसे screen करोगे? Retinol, night blindness, carotene, white hot spot. What will you do in screen? If I now remember, teachers भी screening कर सकती है. So for school, what is the thing that we are going to use? Don't say white hot spot. Teachers can't make up that. What will we use? Night blindness. Although white hot spot is used as an epidemiological indicator, more specific finding is white hot spot. देखो guys, first symptom is night blindness. Most specific is white hot spot, ठीक है. But the common symptom that we use over here is night blindness. Keeshan's disease, cardiomyopathy, cardiac muscles affected. Keeshan's myopathy is due to deficiency of selenium. Very good. All these questions have come before. Copper तो नहीं आना चाहिए. चलो, and now last thing, glycemic index. A diabetic patient comes to you for advice regarding his diet. You advise him to include foods with low glycemic index in the diet. Which of the following would you advise him for the same low glycemic index? Cornflakes, papaya, brown rice, sucrose. Cornflakes मत बोल देना. Papaya. Papaya. All right, papaya. Most fruits and vegetables are low glycemic index, okay? Most fruits and vegetables are low except watermelon and potato. Now look over here, low glycemic index, most fruits and vegetables, beans, lentils, whole grain. Moderate, basmati rice, brown rice and all this. High, cornflakes, baked potato, white bread, watermelon, potatoes. इसमें से कुछ आ सकता है. एक और बार एग्जाम में क्वेश्चन आया देखो. Which of the following food would you advise to a person suffering from CVD? क्या एडवाइस करोगे? वाटरमेलन, हाई GI, कॉर्नफ्लेक्स, हाई GI, ब्राउन राइस, मीडियम GI, होल ग्रेन्स. ठीक है, रिमेंबर दिस लिस्ट. होल ग्रेन, बीन्स, लेंटिल्स, दे आर ऑल लो GI. ठीक है, ब्राउन राइस समवॉट मॉडरेट GI है, वाइट राइस तो हाई GI है. ओके, मोस्ट सेंसिटिव इंडिकेटर ऑफ एनवायरमेंटल डेफिशिएंसी of this one, environmental deficiency, neonatal hypothyroidism. Now see, median iodine, this is important, that is why I have brought this up, the indicators for iodine deficiency. So we have a national iodine deficiency disorder control program. Median urinary iodine excretion less than 100 indicates insufficient iodine intake. This is used as epidemiological assessment. So if anybody asks you epidemiological indicator क्या है iodine के लिए, median urinary iodine excretion. It is effective indicator of national program. Neonatal hypothyroidism, environmental, ये दो आता है. Epidemiological indicator, environmental iodine deficiency indicator. Serum T4 level is more sensitive than T3, we all know. Quality control of iodine and salt is performed by rapid testing with an MBI kit. But here at the production level guys, what is the amount at production level? कितना होना चाहिए everybody? Production level में 30 ppm and at consumption level what is the amount? 15 ppm. 15 ppm. You all know that we have double fortified salt, twin salt, जिसमें iron and iodine होता है. So 40 microgram of iodine per gram of salt is what we are suggesting. Double fortified salt. These are all examples of primary level of prevention. Also look at this logo. This I have discussed in image-based session. National Iodine Deficiency Disorder Control Program. National Iodine Deficiency Disorder Control Program. So you can talk about this. जिसमें you remember I had given you an image long back. एक woman है जिसने ऐसे करके एक red रंग की बिंदी लगाई हुई है. So they ask in the exam what is this red बिंदी? जीवन बिंदी. This is constantly releasing iodine. इसको बोलते हैं life saving dots. If they give you in the exam life saving dots, don't write TB वाला dots. This is जीवन बिंदी. Okay, what is this image? What has happened to this? Acrodermatitis enteropathica, which is inherited defect in uptake of zinc cells. Acrodermatitis enteropathica. This came last time in NEETPG guys. Inherited defect in uptake of congenital inherited defect in uptake of zinc cell. Clear? Now guys, there is one thing, again zinc is a trace element. एक concept आया है guys, my plate का. I am going to share the post on like how much what we should be consuming. ठीक है? So I have shared this post on Instagram, my plate. It's a little big thing that I will share it currently on Telegram also. Please check it out. It has कि हमें कितना food groups कौन से लेने चाहिए. I couldn't bring it here today. I might bring it on the programs day. I will add it in the presentation, but I will also share it on Telegram right now. I've shared it on Instagram. Go through this my plate wale slides. I will bring it once we do diseases, alright, and NHPs. In that when we talk a couple of programs, I will show you what is this my plate. ये आ सकता है expected MCQ, ठीक है, my plate. अभी मैं इसको diseases वाले दिन ले आऊँगी the image, but right now I'll also share on the Telegram group so that you read it today as well. Yeah, it is important. It's in our textbook of park. It is important, guys. Nothing is very different when it comes to PSM for NEET PG, FMG for that matter, even INICT. That is why I tell you, NEET PG aspirants, if you missed out your Sure Shot NEET PG, do Sure Shot FMG. FMG वाले बच्चे NEET PG का क्वेश्चन लगाओ, NEET PG वाले बच्चे FMG का क्वेश्चन लगाओ. It is very very important. ठीक है. So I'll bring that my plate on the National Health Program days. If you are on my Instagram, you can check it out. अभी मैं Telegram में भी share कर दूँगी. Just go through those 3 slides of my plate. Okay? चलो. वर्किंग का बात नहीं होता. वर्किंग में if it's written she is a laborer, so in that case she is a she is a heavy worker. So in that case plus 350 तुम heavy worker woman के requirement में कर दोगे. Add like plus 350 if she is a laborer, you're going to add this plus 50 to plus 350 to 2700. Okay, like teachers, doctors, nurses, we are all sedentary workers. Moderate होते हैं shopkeepers, laborers होते हैं heavy workers. Clear? So this is it. Tomorrow, very very important day. It's preventive ops, it's RMNCH, it's healthcare delivery system. 10th and 11th ka class I will take it in one lecture, guys. Diseases as well as NHPs will keep it in one class. Okay. Thank you so much everybody. INICT ka latest recall dekh lo if it is good for you. Bhakti, ideal time for IUCD na 48 hours hai na 6 weeks. The ideal or the best time for IUD insertion is during menses. Now after delivery, when do we insert it? Like we can insert it within 48 hours of delivery or after 6 weeks. ठीक है, we will not insert it anywhere between 48 hours and 6 weeks because there are chances of expulsion of IUCD. Is it clear? पूरा PYQ based session था आज completely everybody. So see, arsenic ideally they talk about 0.01 which is the same as the lead, guys, but Indian Commission कभी कभी उसको 0.05 भी बोल देता है. Clear? Numerical practice is on 13th. So thank you so much everybody. I will see you again. Vora, please go through concept of health class. I have spoken about Hale and Sullivan index there. PSM revision, यही है तुम्हारा PSM revision. LRR, if you can't do RR, go for the LRR. LRR, image session, करना ही करना है. If time permits, alright, if time permits, 100 one-liners, अगर time permit किया, otherwise this one and daily sure shot. Clear? So that's it everybody. I am going to see you again tomorrow. Thank you so much. Bye bye.